we'll open up the imaging viewer. This is under Tools, CPRS Imaging. I've opened this already to save us time from having to log in. So that's here, and it will generally appear something like this when it opens. This first box is largely text information, which is available elsewhere, so we can close this. Most importantly with this imaging viewer is it's going to open up a number of different windows here, which all have slightly different functions. However, this small one is the most important to pay attention to. So this box really controls all of these other separate windows. So if we minimize this, it goes away altogether. And then if we wanted to return, we would open that back up again. If we minimize just one of these, it's going to shrink it down in the corner by itself, and then we have to open it up separately. But it can get lost because it will appear sort of down in the bottom of your screen somewhere. So really just use this box, the small one that has the patient's name. Sometimes this will have a patient photo as well. Use this to control the imaging viewer here. These other windows, so this one starts off small. Specific cases that this might be useful are if you had an echo in the DCVA, at least, we can actually see echo images in this area, so you could find it there. Also, scanned documents into the patient's chart might show up in this area. So those are the most useful things for this sort of window. This is the primary imaging viewer. So for imaging tests done in radiology, this is where we would find them. Unfortunately, neither of these have images available, so I can't show us how to open them. But that's where these are. I personally do not use this window, so I won't walk us through that. Not going to let us open these at all because our patient doesn't have any images. So if you have a patient with specific images, you can just double click on these and it will open them. For x-rays in particular, from memory walking you through this, if you double click on this, it will open up a little thumbnail. If you double click on the thumbnail, it will open up the full image. If you click on the heading, it will be maximized like this when it opens up the image. If you drag the heading out of the way, it will shrink the window back down, and you can again see the thumbnail view. If you then avoid that thumbnail and come back to this this box with the list in blue, then you can find an old X-ray and double click on it. And it will open up the thumbnail for the old X-ray instead, while still having your image open that you dragged out of the way just a second ago. If you right click, not left click, but right click just once on the thumbnail of the other X-ray you want to compare, then you can choose the option Open Image in Second Radiology window. That will give you a side-by-side comparison of the two X-rays, and then you can double click and maximize it again. When you do that, sometimes for whatever reason, it will sort of split them into opposite sides of the screen with a blank space in the middle. There's an option in the imaging viewer that allows you to change the display ratio. I think it's view settings. If you select that in the top, it's sort of in the file, this kind of options menu. Select 2x1 and it will just go back to normal. And then you can look at a side-by-side comparison. You can do something similar for CT scans. CT scans, again, in this sort of top area, has a view setting where you can change, abdomen, chest, head, whatever you want your view setting to be for the type of image you're looking at. And if you select the first image in the set of thumbnails, You can also do a sort of side-by-side comparison of CT scans. Your slices might not line up exactly, but there is a mechanism to do that. In addition, in this little window, this is also where we look at our EKGs. So if we open up the EKGs, it's going to open up this window. Unfortunately, our patient doesn't have any EKGs either, but usually it opens up pretty small like that, and it's good to expand it. And you could select your EKG. It has a list of them. In this area, you can compare more than one by using this and just determine, how many you want to look at. This is sort of auto fit to width. So if you have your EKG open and it's a small little box in here, you can select this and it will maximize it to the full width of this. So you can review it more easily. But that's the EKG viewer, and that's pretty much it for the default CPRS imaging viewer.